go ahead and get started. First of all, I'm certainly happy to be here. My name is Mike Simmons. I'm Director of Advocacy and Professional Relations at Lilly. And I'd like to thank all of you for being here, and I'd certainly like to thank the mayor for allowing us to do this event here in the Eagle Room. This year, Eli Lilly Company launched a campaign called the Alzheimer's Readiness Project. And the idea behind this was to be able to educate policymakers, elected officials, and the public at large about the challenges associated with Alzheimer's disease, and to help ensure that the public and everyone else understands how important it is for early intervention to take place, and that people are working together to actually be able to better address the challenges that we have coming at us. As we look at Alzheimer's disease, there's a number of challenges. One, it's one of the most expensive diseases that is being treated today, and it is growing. And in fact, today there's 5.4 million people who suffer from the disease and are experiencing and living with the disease, and that number is expected to grow to over 15 million in the coming years. And the challenge is that there's no way to, at this point, prevent it, to cure it, or to slow the progression. However, thankfully, after decades of research, we may actually finally be on the verge of new treatments that may actually attack and treat the underlying cause of the disease. And what that means then is that state and local governments are really going to have to be ready. And as they do that, it means that they need to be ready to be able to coordinate the work of a number of stakeholders, including the medical practitioners, health systems, community service organizations, and certainly more. And it's all done with the idea of being able to ensure that people with the disease are able to get a diagnosis, that they have access to the supports and services that they need, and that they have access to treatment. Certainly not easy work. But that work is beginning to happen here in Boston, and that's the reason that we're here today, is to be able to really draw attention to great work that's already happening here, and to the essential partnership that's taking place between the City of Boston and Mayor Walsh and the Alzheimer's Association, Massachusetts, New Hampshire Chapter. Boston is certainly lucky to have a leader like Mayor Walsh, who has really, I think, helped set a vision for what can actually happen with Alzheimer's disease, and to put a number of steps in place to begin to make that happen, including the Boston Alzheimer's Initiative, which really offers supports and services to people with Alzheimer's disease and their caregivers, and helps raise awareness about the importance of early intervention. And then there's the Alzheimer's Workplace Alliance that brings together 17,000 employees to really make a difference in the lives of Bostonians. And that's obviously done with a number of other agencies as well. And then the latest endeavor that really I think is a fantastic one and really helps to set the city apart are the memory cafes that have been launched just this week, which help to ensure that individuals with memory problems and their caregivers actually have a place to go for supports and services. So it's for that reason that we wanted to be able to honor the City of Boston and Mayor Walsh for all that great effort. Mayor, I'd like to invite you up to receive this award. This is the Alzheimer's Readiness Project Award, and it's being given on behalf of Eli Lilly, and I'd like to present you and your administration with the award.
Thank you very much.
I'll just open it up to you for some comments if you'd like.
I want to thank you, Michael, and I want to thank everyone at Eli Lilly for what you do. Thank you so much. I want to thank Jim Wessler as well and the Alzheimer's Association, and I want to thank everyone. Thank you for the recognition, and really the person who deserves that is Emily Shea and the Elderly Commission in our city, who do incredible work, so I want to thank them for what the great work they do. Alzheimer's is a tough illness. My grandmother had it. She was in Ireland, we were here, so we didn't see the gradual loss of my grandmother. We saw a very dramatic loss, where every time we'd go back home, we'd see her in a different way, and the pain and suffering for the family was tough. It was tough for my mother, because my mother would talk to my grandmother thinking that she remembered her, and she would say, "What do you think?" I'm like, "Oh, I think she remembers you, Mom." And I'll tell you a quick story. So we're in, and at that point, I didn't know how to deal with Alzheimer's. I knew it was the disease. I didn't know what to do. And I remember one day walking downstairs, and my grandmother was sitting in the kitchen by the fire, and she looked at me, and I looked at her, and many days we did the same thing. And so I beat her to the punch this particular day. I looked, I go, "Who are you?" And she says, "I'm Mary Ann." She goes, "Who are you?" I said, "I'm Martin." And I said, "They feed you around this place?" And she says, She says, no. I said, not even a cup of tea? She goes, no. I said, you want one? Yeah. So we sat down, had a chat, and, and my aunt at the time, was still my aunt, was the caregiver. And she kept my grandmother at home for a long time. Until almost towards the end, and my grandmother for 2 years basically laid in a hospital bed, and so I think it's important for us as a city to take care for our elders, and also help educate family members who have no idea about this disease. City Councilor Frank Baker just lost his mother 2 weeks ago, and she had Alzheimer's for about 15 years, and she lived a very healthy, happy life with her family, but it was a sad situation. There was 13 Bakers in the family, and during the time of her disease, a couple of her kids died, and one of her grandchildren died. But the family was there all along, and they gave her loving care. And I'm certainly know from the Baker experience or from the Walsh experience, actually the O'Malley experience, not every family has that ability. So the work that's being done by the Alzheimer's Association, all of you here, and most of the people in this room, I want to thank you. I'm honored to get the recognition. I'm honored to be recognized for it. But again, it's not me. It's the people that work. It's the Elderly Commission who does incredible work in our city of Boston. That's why we are prepared. That's why the memory cafes and everything we do to try and help families. So again, I'm honored to get this recognition. I did not follow any of these notes at all. I probably missed a whole bunch of stuff. Emily's probably like, talk about this, talk about that. We have an old growing population in the city of Boston, older population. We are working to make sure families have the resources they need if they need them, and we're going to continue to do that in our city. We're going to make the priority our seniors and make sure the families, any challenges they have, particularly around dementia or Alzheimer's, that the families have the support they have so they can make sure their loved ones have a great life until they pass, until they leave us, but also make sure the families have the supports they need to be able to deal with the addiction of Alzheimer's. So thank you very much.
Now to recognize the other part of this partnership, as Mayor Walsh said, the Alzheimer's Association has also played an integral role here in Boston through the Massachusetts and New Hampshire chapter. And just a couple things I'd like to just point out of the work that's been going on, and I'd like to invite Jim Wessler up to receive this award as well. But just to point out a couple things quickly is just the support groups and the things that they're doing to help educate and to support both patients and their loved ones, as well as to be able to help educate healthcare professionals with things through Map Through the Maze and other events, and through work that they're doing with the walk that's coming up on the 25th. We can't help but to recognize that as well as an important step. So Jim, I'd like to recognize you also with this Alzheimer's Readiness Project Award, and thank you for all your efforts as well.
Thank you very much. So first of all, Mike, thank you so much, and the team at Lilly. I know you have some of your colleagues here. We thank you, and Mayor Walsh. It's been a good partnership, and we really appreciate it, and we look forward to much additional activity in the coming years. I mentioned Emily, so my team puts everything on one piece of paper, so I got you covered on some of this stuff. I do want to, as the mayor so eloquently mentioned, this really, a lot of our partnership is around the families, the people who are both living with this disease, and the caregivers. I do want to acknowledge Lilly. They are, for many reasons, but they're a pharmaceutical company, and they are our leader in the research space. They have a number of clinical trials that are currently actually in phase 3, and so some of the Mike spoke generally about we hope to see some disease-modifying drugs, and Lilly's not the only one, but we're rooting for them all. But we know that actually really in the coming 12 months, we're going to start seeing some results of some of these in the ensuing years. So our vision at the Alzheimer's Association, we say, is a world without Alzheimer's disease, and we're very passionate about that. So we certainly hope some of these strike gold, and we start seeing some way to start changing the course of this disease. In the meantime, though, there are, as Mike said, 5.4 million Americans with this disease. over 120,000 here in Massachusetts, and thousands, Mayor, here in the city of Boston, and certainly well over 10,000 caregivers here in the city that are every day trying to struggle to deal with this disease. So working with the city, we really, I just want to mention a few of the things that we're very proud of. I see there's a representative here, the EMT, and we were pleased to be able to partner with the city, trained over 300 EMTs. So part of what we've been trying to do is to both educate and train and partner with a number of the frontline staff here in the city of Boston. So EMTs was first. I think we're close to coming up with something with the fire department here in the city. And Mr. Mayor, if you don't know, the Alzheimer Association has been working statewide, and we just reached agreement about 6 weeks ago that all 10,000 veteran police officers in the Commonwealth of Massachusetts over the next 10 months, including the city of Boston, are going to be going through a very basic Alzheimer's training. So these frontline first responders, when they encounter, whether it's a EMT call or a police call, and they're encountering a situation where both either the person is cognitively impaired or the family is struggling, they now know and will know where to turn to, both to collaborate with city services, but also with the Alzheimer Association, community services, memory cafes, and those agencies. So really holistically see if we can wrap around better support for the residents here in Boston. We've done a number of trainings. Chi, I want to recognize you. It's been a pleasure working with you as well as with Emily. We've done trainings for the City of Boston employees, for two reasons. City of Boston employees, 17,000 of them, are themselves dealing with this disease, and so we at the Alzheimer's Association want to provide assistance. And like EMTs and police and fire, Boston employees are also dealing with the public. And so if we can help them, and Mayor, your team, all 17,000 of them, be more effective as they do their jobs, we're all going to benefit. I want to mention, Mike's very aware, but we've done a lot of work in the healthcare space in terms of engaging hospitals and health systems. Most of them are here in the city of Boston. So we have these partnerships where we're working directly with clinicians and insurers here in Massachusetts. Boston Medical Center actually just reached agreement with us. Liz is here and helped negotiate that. We're very pleased about that. Beth Israel Deaconess, McLean, Partners, and then Blue Cross Blue Shield and Tufts Health Plan. So don't have time to go into that, but these are partnerships where families immediately get connected to help. Our team proactively reaches out to them. There's no delay of days or weeks or months. We're immediately connecting families. You mentioned the walk. Those of you who came in the front side of City Hall saw that wonderful banner for the Walk to End Alzheimer's, and Mayor, we're so appreciative that you've agreed to be the second year in a row the honorary chair for our walk on 25th of this month. It really is, it's obviously raising resources for our cause, but it's also really raising public awareness and galvanizing thousands of people. And so having the mayor of one of the preeminent cities in the country as a leader of that, it just makes a big difference. And so we will continue to partner with Emily and her team to throughout the city do educational programs as we try to educate the residents here in the city of Boston and get them the support that they need. We also, just kind of last thing I want to mention is that we've done a lot of work with faith-based communities, and I don't even know how much you're aware of this, Emily, but we have a really nice initiative with Latino volunteers that are working directly with a number of Latino churches and communities of faith here in the city of Boston, and we want to see that continue to grow and expand. So we look forward to working with the city. I appreciate us, Alzheimer's Association, being recognized, but really it's also Mayor. It's a lot about you. This is not happening in every community, either in Massachusetts or in the country, and it really takes a visionary leader like you to say, this is important. Too many people are struggling with this disease. We need to get them the help when they need it, how they need it at the right time. So I want to thank you again for your leadership, and Mike for Eli Lilly's recognition. Thank you very much.
So you can see why, based on both the mayor's comments and Jim's comments and the things that are going on here, why we're doing this award here today, why we wanted to be able to recognize both the mayor and the Alzheimer's Association. This is a unique community, and there's unique things going on here, and it's this kind of work that we want to draw attention to, and we look forward to being able to work together with you in the future to really help ensure that we can do what we can to help support your efforts here, and that these kinds of things also get more wide recognition across the U.S. So I'd like to thank each of you for being here. I'd open it to questions. If anybody has any questions, we're happy to be able to take a couple. Okay. Well, with that, we'll go ahead and close. And again, thank you for being here this morning.